Hello, I'm Dr. Max Greig. I'm an orthopedic surgeon in Puerto Vallarta, Mexico. If you have a knee problem, or hip, or shoulder, or back problem, please contact us because we can help you out with your orthopedic situation. We have been in practice for over 20 years, and we have a lot of Canadians and Americans that come down here every year to look after their orthopedic problems. So if you're one of them, you can trust us. We can take care of you. We make sure that you are cared for from the moment you arrive to the moment you leave. Our team of very educated and well-trained staff will make sure that all your needs are covered. Welcome to Mexico. Down here in Puerto Vallarta, Mexico, is we care for people's knees, shoulders, backs, and hips. The other joint we have problems with is a shoulder joint. We have a lot of rotator cuff problems. That means people cannot lift up their arm to reach up high or try to do something, either like combing their hair or brushing their teeth. So one of the main problems we find is that people have developed a spur on the undersurface of acromion, and that spur keeps the shoulder from going upwards. Therefore, there is an impingement of the tendons, and one of the main tendons that gets trapped is called a supraspinatus tendon. So this needs to be repaired, and the spur has to be removed. This is called a rotator cuff surgery. One of the things that we find a lot is joint problems. Well, a very common problem is when we wear out our meniscus. Our meniscus is those little cushions that we have inside the knee, so that every time we take a step, those cushions take away the impact that happens at the end of our bones. Therefore, it saves our cartilage. So those meniscus can get ruptured, and we can have different kinds of ruptures. So to fix this, we do a procedure called arthroscopy surgery. It's like looking at the camera and seeing everything on the screen and going in with a lens to take care of your knee problems. The other very common situation we find is when people wear out their cartilage. Every joint has cartilage. So as we grow older, that cartilage starts to wear off. Here's an example of normal cartilage, and cartilage that starts to wear out. And it gets down to a point where it's bone on bone. When that happens, you have the noise of the knee hitting against each other. The same thing can happen with your hip joint, where you can wear out your ball of your femur, and it can create a big painful joint for yourself. I'm going to show you here how a normal joint looks like. Normally it's nice and smooth. The color of cartilage is off-white. Here they painted it blue for educational purposes. So at the beginning, when we are young, all of our cartilage looks good. But as we grow older, it starts to break down. Some of the cartilage starts to break on you. Then it eventually keeps wearing out, and you start seeing part of the cartilage missing off of your joint. And then it comes to a point where it's completely off, where it's bone on bone. When you get to this point, then what you need is what we call a knee prosthesis. A knee prosthesis is formed by three parts. It has the femoral component and a tibial component, and this insert that goes in between to resemble the meniscus. This here shows how a knee prosthesis will work like, so that you can function and go back doing the things you love to do. The back is formed by 33 vertebrae, but most of the issues happen in the lower part, where one of this discs between the vertebrae bodies can herniate it, and it can push against one of those nerves. The nerves that come down from lower back go to your legs, and the nerves that go out of your upper back go down to your arms. So we can also treat it down here in Puerto Vallarta, Mexico. Yes, and we also have the hip joint. This femoral component goes inside the bone. All bones are hollow inside, so we remove the head and we place this implant right into the bone, so then we can connect it to our acetabulum, and then we can perform our daily activities that we love to do.